My name is Mirza Shahzad Hassan. I'm a general surgeon based in Toledo. I'm originally from Pakistan, but I did my residency training here in the U.S. and have been in Ohio for the past 13 years. I joined the group of Northwest surgical specialists. That's Dr. Timothy Duckett and Dr. Beth White. I joined them in their practice at St. Luke's Hospital, and we had been doing robotic surgery for these past several years. Henry County Hospital was kind enough to offer us a job here, and so we started doing additional work at this facility. My partner, Dr. White, is probably the most experienced of all three of us. She trained to do robotic surgery about 15, 20 years ago, and then she in turn trained my partner, Dr. Duckett, who's been doing this for about 10 years, and I've been doing robotic surgery for a little over 5 years now. A lot of our patients, they would prefer to go to other facilities to get their robotic surgeries rather than get the old-fashioned open operation here. For instance, a simple example is inguinal hernias or groin hernias. I used to do them open until I switched over to the robotic technique. It gives us binocular vision, and it magnifies the image by about 10 times. So it gives us a much clearer view of tissues we're operating on. It's like operating with tiny hands inside the patient's belly, and we can actually put stitches in and dissect tissue much more accurately than with the traditional laparoscope. It's better in terms of control. It's also ergonomic for the surgeon because we're sitting at a console. We can sit and do long operations without getting tired. It has allowed not just general surgeons, but other specialties to do their job in a more accurate way, such as prostatectomies by urologists, hysterectomies by gynecologists, even nephrectomies. So those are the reasons why we brought up the issue of the robot, and the hospital was kind enough to provide us with one. The surgical robot has been developed by a company called Intuit, or the Vinci company. It actually rotates, so you don't have to undock and then reposition it and then redock if you want to access a different part of the abdomen. What we do is we make little incisions and put small ports in the patient and use the laparoscopic gear like we do for gallbladders and appendix surgery, except that the instruments are docked to the robot. The robot has arms which connect to these, and then the surgeon sits at a console within the room and using small joysticks operate the robot. Whatever we do with our fingers is translated literally millimeter by millimeter by the robot itself. It cannot do anything unless the surgeon tells it to do something. At this time, the most common operations we're doing are inguinal hernias, abdominal wall or ventral hernias, cholecystectomies or gallbladder removal, and colon surgeries like taking out part of the colon, whether it's for cancer or for diverticulitis. We're also doing anti-reflux operations where you do the stomach wrap to prevent reflux. My partner, Dr. White, has already done about 3 or 4 of them here at Henry County Hospital. So she has kind of pioneered this technique at this facility. I think it's a better operation. It gives a quicker recovery, less pain after the surgery. It just allows the patients that choice to have it done in their own hometown rather than to go to a different city.